Hi, I'm Evan Renz. I serve as the Associate Chief of Staff for Quality, Safety, and Value here at South Texas Veterans Healthcare System. You may have recently watched a presentation by Dr. Flynn, our Chief of Staff, who talked about our high reliability journey. This morning, I hope to share some additional thoughts with you about this process. One thing I want to say very early on is that the high reliability organization journey that we're on is not a project. It's not something that we simply undertook on a temporary basis, but it's truly part of our culture. And over the next weeks, many of you will be involved on a regular basis on implementing some of the concepts and the ideas that go along with the culture of high reliability. I would like to share and remind everyone of the 5 principles that we use in high reliability organizations. And would also like to ask you to think about organizations and entities that are known for high reliability, such as the commercial airline industry or the nuclear power industry. These are functions that we all know to be very safe and very consistent. Unfortunately, healthcare in the United States is not always safe and is not always consistent in the same way. We know that mistakes do happen. We know that humans do make errors. And the entire premise of high reliability functioning is to accept those realities, but build our system and our processes in such a way that we can overcome those deficiencies and make our daily interactions with our patients very, very safe. So to review the 5 principles, the first one is generally called reluctance to simplify. This is a concept whereby we do not explain away errors. We simply look at the problem, sometimes the mistake, and we examine it and we review the process to ensure that we implemented it in the best possible way, and we look for the places where we can improve. But we don't simply dismiss it as a natural part of life. Another principle is preoccupation with failure. Although the phrase itself may sound less than intuitive, it really makes great sense. We know that things can occur and do occur, and so we, as a team, as a staff, are constantly looking for the things that could go wrong, the near misses, if you will. And as I remind us of the concept of a near miss, I encourage everyone on the team to be watchful for and diligent about reporting near misses using the Joint Patient Safety Reporting System. Because the more we report these near misses, we can help prevent the major events. Another term, another principle that we're reminded of is sensitivity to operations. What this focuses on is emphasizing that the staff members on the front line, oftentimes at the bedside, in the clinics, in the operating rooms, are those who are most familiar with the daily operations that we need to focus on. And so we want to make sure that we are surveying and interacting with the personnel, each of you, who is performing our mission each and every day, so that we are in tune with the current practices and problems that we face, so that we can make adjustments for them and implement an overall process that is safe for our patients based on those experiences. We also need to make sure that we have a commitment to resilience. Just as we know that things can go awry and not as planned, we have to be able to bounce back or adjust from those events. We cannot let them overcome us, but instead we must commit to making sure that we're doing everything we can to make our processes safe and prevent the problem from happening the next time. And the last thing that I'll highlight under the principles of the high reliability is deference to expertise. all of us have strengths and weaknesses. And in a high reliability organization, we don't want to rely too much on our organizational structure in decision making, but want to make sure that we're involving those who have the best information, the most real-time information and expertise as we go to create our processes and also to implement the best possible plan. All of these things come together with a simple focus of what we refer to as zero harm. Now, the idea of zero harm can be sometimes misinterpreted to mean zero defects, but they aren't quite the same, because we know that defects do occur. We know that mistakes can happen, and we're constantly watching for them. That's why we have a preoccupation with failure. But the entire concept of zero harm is a cultural aim for us. It's focusing on providing services and care that will, to the maximum extent possible, eliminate or at least minimize and mitigate any harm that could possibly reach our patients. And that is why things like focusing on near misses and building processes to find the weaknesses in our stepwise processes and redo them, remodel them, is so vitally important if we're going to achieve the ultimate goal of zero harm. So, with that brief review of the principles of high reliability organization, I am very, very happy to be a part of this process here at our organization, where we're going to work together as a team, emphasizing the expertise that we have readily within our hallways to build a culture and a system that is extremely safe and able to provide the highest quality care for our veterans each and every day. Thanks for watching.